Professor Janet Lord and I'm the head of the School of Immunity and Infection and I'm an immunologist. Prior to coming to the University of Birmingham, I was a postdoctoral researcher at the University of Oxford working in the Department of Clinical Biochemistry, and there I worked on diabetes research and in particular what controls the release of insulin. When I came to Birmingham, I then became more interested in immunology. So most of my research now is concerned with what happens to your immune system as you get older. So what we're really interested in is why so many diseases like rheumatoid arthritis and cancer are age-related. If all of these are caused by aging, why not try to understand the aging process better in order to tackle all of those conditions? So that's really what my research is about. Most recently, we've been very interested in why older people are more susceptible to infections such as hospital superbugs like C. difficile or MRSA. And the main immune cell that tackles these infections is called the neutrophil. And what we've discovered is that as you get older, your neutrophils basically don't move correctly towards the infection. I always say they look like they've lost their sat-nav, so their directional control is completely gone. And this is disastrous if you're trying to get the immune cell to the infection as quickly as you can. And what we've discovered is not only that that happens, but we've also discovered why it happens. And that has helped us to really use new drugs to try to correct that defect. So what we're doing now is working with doctors here at the university to give this drug to older people who've got pneumonia to hopefully help them tackle the disease much more effectively. We feel that our ageing research is really important for society. We know that we're an ageing society. So currently 16% of the population in the UK are over 65, but by the year 2035 that's predicted to be 1 in 4. And as we get older, we know, as our research has shown, that your immune system doesn't work as well. So it means you're more prone to infections, you're also more prone to cancers and to conditions such as rheumatoid arthritis. So our real hope is that our research will all lead to improved health in old age. We want to make sure that old age is enjoyed and not endured. For my greatest achievement to date, I think I'll actually cite 2. So as I'm very interested in making sure that we get discoveries at the bench right through to the patient as quickly as we can, I would probably list number 1 as my first drug that came to clinic last year. So in the early stages of my career, I was very interested in cancers, and I discovered that there was a particular molecule called protein kinase C delta that was important in inducing cells to kill themselves. And I worked with an Australian company to discover a compound that would cause cells to do this, and this came to market last year for the treatment of a pre-skin cancer condition. So I would definitely cast that as my highlight. And I think the second one really is my work on ageing. So I think that's also going to have a great impact improving health in older adults and particularly helping them to fight conditions like rheumatoid arthritis and disastrous infections such as pneumonia. And I've already been recognised for that, so I was lucky enough to receive the Lord Cohen Medal from the British Society for Research on Ageing, and this year was awarded the Glenn Foundation Medal for contributions to ageing research. So far, I think I've supervised approximately 20 PhD students, and every single one of those has stayed in science in some form or another. Approximately 50% of them have gone on to work in industry, with 2 of them actually forming their own companies. The remainder have stayed in academia in some form or another, with one of my past students, who was a Hungarian student, Dr. Postgraduate, is now a professor of immunology back in Hungary in Debrecen. One of our leading attractions is the networking possibilities. So in the School of Immunity and Infection, it's a very large unit. We have over 200 researchers, both postgraduate and also academics, and there are several opportunities to network. So we have everybody from the PhD students to the senior staff presenting their research on a regular basis. So every Wednesday morning we have an item called the Breakfast Seminar, where people meet together and listen to PhD students. And this goes right through to another structure that is called the Happy Hour Seminar, where the very senior researchers present their ideas and their research. And these are attended by all of the members of the school. So students rapidly become integrated into a strong network of researchers. In my experience, international students have really enjoyed coming to Birmingham and certainly being part of the School of Immunity Infection. And the sort of feedback I've had from them is that they were looked after really well. Particularly, it's quite a big move for a student to change country and to come to the UK. They felt they were welcomed and they were looked after, particularly in those first few months when they were settling into a new environment. They also found that they had good support through their studies, were given any extra help they needed in basic background. But what they also enjoyed really was the city of Birmingham, the campus. Having a large campus made it easy for them to settle in. They weren't having to travel around the city to get to different aspects of their work. So it was all on a single campus. And also what they liked was really the diversity here at Birmingham. It's really important to me that we ensure that the next generation of researchers are enthused about what we do here at the university and in my School of Immunity Infection. So for me, teaching is important and working with undergraduate and postgraduate students. My aspirations for the future are really to ensure that the research that we do at Birmingham and in my school really translates into making an impact for society, and in particular, of course, for health. And with my current interest in ageing, I really want to ensure that more older people reach old age in good health and stay in good health for as long as possible.